Tell us how dire the situation is in Saskatchewan right now.
I don't really know how else to say it. I mean, it's about as bad as you could imagine. I mean, we have unofficial ICU triage happening at the bedside. Our clinicians having to make very, very difficult decisions again about who gets resources, who lives and who dies. We have, people being flown out of the province. Dr. Warner, kind of mentioned all of this and kind of let it all out on social media a few hours ago. So 6 patients over the next 3 days. At the press conference earlier, the Premier just kind of mentioned again about how he was just asking for federal help after asking for help from, provinces and apparently American jurisdictions as well. And yet somehow we have no gathering restrictions in place. We have, again, almost very, very limited restrictions overall, other than for our certificates and passport program. And, there's really no clear end in sight. It's going to be a few more weeks of pain before we get out of this.
And what are we seeing in terms of the numbers vaccinated versus unvaccinated, Dr. Wong?
So there's still, the preponderance of individuals in ICU, I'd say 3/4 at least or higher, who are not vaccinated. Like all other jurisdictions, there is a small number of individuals who are fully vaccinated with COVID-19 in the hospital, and then a large number of people who are partially vaccinated as well. So it remains critically important that people go and get vaccinated as quickly as possible. Now that we've had our vaccine mandates and passports in place since October 1st, we've seen a significant uptick with that. Obviously, we need to try to keep pressing that as much as possible. But, our dynamics are not different than anywhere else, as we're just struggling based on volumes right now and the fact that our staffing is so tight.
I wonder, when it comes to staffing, what is the most important priority here in terms of different tasks?
There's not really an easy way to answer that question. Again, I mean, providing critical care is incredibly complex, and you need a very specialized skill set and a lot of specialized training to prioritize, what needs to be done. And so, we're just a small province. So again, comparatively speaking, we have 84 ICU patients right now in Saskatchewan. And I mean, that would translate to like 1,050 ICU patients in Ontario. And so practically speaking, again, I think at the bedside, everybody is making, the best possible decisions and doing what they can. And people are doing a tremendous job. It's just, if we keep kind of pressing these numbers as we are, there's going to be a situation where we're just not going to have enough staff to safely look after people. Even transporting like 6 patients out of province is going to make a significant difference and give us a bit of a wiggle room and capacity if something happens that's not good, like if somebody gets in a bad accident or something like that, there's multiple victims. That's going to allow our system to try and accommodate and support those people here in the province.
Dr. Wong, I appreciate your time today, as always.